go. All right, welcome everyone to the Rhode Island Civic Health Index Community Partner Opportunity Information Session. We're so happy that you're here and really appreciate your taking the time to learn more about what we're doing with the Civic Health Index. This is hosted by Rhode Island Council for the Humanities, which I'll speak more about in a second, but mostly we're just happy you're here, so welcome. So I am Julia Renaud, my pronouns are she and her, and I'm the Associate Director of Grants and Strategic Initiatives at the Council. Rachel.
Hi everyone. I'm Rachel Jeffers. I'm the Associate Director of Engagement at the Council. Also, my pronouns are she, her, and we're just so glad that everyone's here. We've been really excited about the response that the Civic Health Index Community Partner Opportunity is already receiving after barely a week of being out in the world. So glad you're here, and turn it back to Julia.
Thank you, Rachel. So just a bit of housekeeping before we get started. The session will be 45 minutes long today, so hopefully won't take too much time out of your busy days. I'll give a presentation kind of overview of, what the Civic Health Index is, who we are, and what the opportunity is, and then we'll have a Q&A session. So like I said, before starting the recording, the presentation portion of the session will be recorded, but we'll stop it for the Q&A, and the recording will be published online following the session, and we'll also circulate it to anybody interested, including you. So if you do have your video on during the presentation, your image may be in the recording published online. So if you do not want that, please turn off your video now. And the Q&A session will not be recorded, so you can turn your video on or off, during that session as works for you and what your preference is. And we ask that you do please stay muted whenever you're not talking. So after the session, we're going to email you PDFs of the kind of FAQs we have, as well as PDF of the various forms that are associated with this. We're also going to share with you the slides from this session, as well as the link to this recording. So if you have a question during this presentation, please put it in the chat and we'll read it and address it during the Q&A session. If you would rather ask your question privately, which is totally fine, in that chat, you have the capacity to message Rachel directly. So you can just message her that privately and she can read it for you during the Q&A session. We are having drop-in office hours regarding this opportunity tomorrow from 1 to 3 on Zoom. So you're welcome to stop by then as well and ask any additional questions, and you can register for that at our website. But also if you know anyone who's interested in this that wasn't able to come today, but they want to ask a question or just connect, I'll just be here with Rachel. We'll be here on Zoom for 2 hours, just happy to talk to anybody who wants to drop in. Great. So to kind of start with who we are, in case you're not sure. So the Rhode Island Council for the Humanities, our mission is to seed, support, and strengthen public history, cultural heritage, civic education, and community engagement by and for all Rhode Islanders. And you see right there in our mission that civic education is included, and that kind of commitment to civic education and engagement is kind of the critical driving force behind this whole project. But in terms of kind of, again, who we are, we were established in 1973 as an independent state affiliate of the National Endowment for the Humanities. So the NEH, which you may have heard of before, that is a federal agency. So we are their independent affiliate in Rhode Island. And we're one of 56 humanities councils found in every state and US territory. So although we are an affiliate of the federal government agency, we ourselves are a private nonprofit 501c3. So we're supported by federal funds from the NEH, as well as donations and grants from individuals, corporations, and foundations. And we're not part of the state government also, I'll just say. So we're not part of any government agency. And what we do is make grants, which perhaps you're familiar with that part of our activity. And we also undertake strategic initiatives, which the Civic Health Index is one. And we are the only dedicated source of funding for the public humanities in Rhode Island. So if you are interested in that grant making side of things, I'm also the person to contact, but we're not going to be talking about that in this session, but please reach out if you like. So in terms of this particular strategic initiative of the Civic Health Index, I also wanted to kind of share with you how we're thinking about civic health and what a civic health index is. So civic health is a way to think about the strength and resiliency of our communities. It reflects the degree to which people participate in their communities, from local and state governance to interactions with friends, family, and neighbors. So both kind of formal electoral participation, as well as informal connections and actions. And it also relates to the overall well-being of neighborhoods, communities, states, and the nation. And we know that well-being encompasses many elements, including public health, education, environment, infrastructure, so on and so forth. But kind of key here is the way we were thinking about it is participation and well-being. So a civic health index is a data-driven assessment of the state of a particular community's civic health. And, so it's basically saying, what is the state of civic health in this community? So there has never been a civic health index for Rhode Island. And what it will do, we're working on creating one, is it will provide baseline context and information about diverse Rhode Islanders' connections to civic life and help us to understand where we are and where we're going together. And the council and its partners will promote the Finnish index statewide and nationwide. And it really is a powerful opportunity to present civic life and civic health in Rhode Island as Rhode Islanders experience it. And we think an index like this will really be able to be used in many contexts, in many different arenas, and can really just help everyone in the state understand where we are right now. So in terms of who's creating it, we are a lead partner on this. So as the Humanities Council, and I wanted to kind of give some more context as to why that is. So, I said we're the independent state affiliate of the NEH. And in that founding legislation for the NEH, as well as the National Endowment for the Arts, there's a statement that we really take seriously. So, which is democracy demands wisdom and vision in its citizens. It must therefore foster and support a form of education and access to the arts and humanities for people of all backgrounds and wherever located. So really, that's asserting, which we take to heart, that engagement with culture and the humanities, it strengthens civic health and the ability of people to fully participate in their communities in formal and informal ways, and that democracy really depends on that, depends on that wisdom and that vision that the arts and the humanities help to foster and strengthen. And so, we really see civic engagement, promoting civic engagement, civic education, strengthening civic health as central to our mission and our work. And other ways that's manifested over the years, it has in the past been an explicit focus of our grant making. We had a specific area of grant making just for civic initiatives. It's now kind of part of all of the grants that we make. We ask about civic relevancy. We also participate in coalitions, including the current Rhode Island Civic Learning Coalition. And we also, focus our strategic initiatives, which are our own projects, on work around civic health. So we recently undertook a project called Culture is Key. You're welcome to read our report if you're interested, but that was really looking at how cultural organizations in Rhode Island strengthen civic health in Rhode Island. And from that report, that was kind of our motivation, because we were looking into that connection, but then saying, what is civic health? What is the state of civic health in Rhode Island? And we wanted to answer that larger question, so we took up this project. And one of our funders is where the project is funded in part by the A More Perfect Union initiative of the National Endowment for the Humanities. So we're very grateful for that support. And so we're also our kind of main partner in this project is the National Conference on Citizenship. So they're a congressionally commissioned nonprofit, founded, I think, in the 60s, around the same time as the NEH and the NEA were. And the National Conference on Citizenship, they established about 15-ish years ago a common framework for the Civic Health Index. So they worked with community organizations, with kind of leading scholars and people in the field of civic health to develop kind of standardized metrics by which they measure civic health. And their model is to partner with cities and states across the country in order to produce civic health indexes for those communities. So they've done over 90 at this point. I think over 30 states have done civic health indexes. Again, Rhode Island has never done that. But other states have used the Civic Health Index over time as a benchmarking mechanism. Some states do it every 2 years, every 5 years, every 10 years, whatever it might be. So we are working with them on this. And then we're also working with local partners, including hopefully you. So to talk a bit more about that. So in terms of what will be in the Civic Health Index, so I mentioned the National Conference on Citizenship, established these kind of standardized metrics. And so what they've done is they've partnered with the US Census to collect data on those metrics and on those indicators of civic health. So, and that's done, I can get more into exactly which census mechanism if anyone wants to know, but I'll leave it there for now. So all civic health indexes include that data. So that's kind of like a baseline backbone running through all of these. And what those metrics are, is they have to do with volunteering and giving. So kind of how are people volunteering in their community, whether or not they're donating to organizations or causes that they want to support. Looking at interactions with family, friends, and neighbors. So kind of those informal interactions I mentioned before. Looking at political involvement, how kind of active are people in participating in politics in their community. It's looking at group memberships as well. So, the different kind of organizations people belong to and participate in, and also voting and registration. So kind of maybe one of the first things you think about with civic health is that kind of electoral participation. But, something that's really exciting about this is that every city, state, whatever, who makes a civic health index can add whatever other data they want to tell the story. So we have this census data as a backbone, like I said, but we in Rhode Island can add any additional data that we'd like to tell a story that reflects civic health in Rhode Island according to Rhode Islanders. So this is really, the census data is a start point and a kind of core part, but we can bring in any other data sets that we want. And so the Humanities Council has been working to collect other relevant existing data sources. And really to kind of get more into community partner work, the community partners are going to help to guide this work and to collect new data for the index. So in terms of what that will really, specifically look like, so the National Conference on Citizenship and the Humanities Council, are collecting and have collected existing relevant data sources, so information that could be relevant to the state of our civic health that already exist. But then we're going to go through a process with, the guidance and direction of community partners around developing, interpreting that data and then developing a new survey to be circulated for the index. So what that will look like is 3 2-hour meetings on Zoom for community partners. So in the first one, there's going to be kind of an orientation, introduction to the project and existing data sources, and a discussion of kind of what stories the data tells, and really talking together about what the data doesn't include and the stories that community partners would like to be included in terms of additional data. So then between meeting 1 and meeting 2, The council is going to draft a survey to collect additional data, directed by that initial conversation. And then in the second meeting, the community partners will review that survey draft, give input on it, and then we'll finalize it. Between meeting 2 and meeting 3, we'll finalize the survey, circulate it, and then, collect and analyze the responses. And then in meeting number 3, those community partners will review those responses and kind of advise on the interpretation and the overall narrative for the Civic Health Index. And following those meetings, the council will draft, the actual report that will be the output, or one of them. And the National Conference on Citizenship, as well as community partners, will provide feedback on that draft. So, and then we will finalize it and hopefully have it out by the fall, which will be extremely exciting. So in terms of, so I just gave a little bit of, I gave kind of an overview of what community partners will do, but to say a bit more about, who are community partners. So we're thinking of them as individual Rhode Islanders who have strong connections within their communities. And that can be geographic, religious, educational, racial, ethnic, cultural, so on. And who have taken like a formal or an informal leadership role within those communities. So I mean, by formal or informal, that could be, okay, like maybe you're the head of a neighborhood association, that would be more of a formal role. An informal role would be something maybe like you tend to organize block parties, or like, the 4th of July celebration on your street, or a lot of your neighbors, and you tend to, if someone's not doing well, maybe you put together a food, a kind of everyone's delivering food to that person's house, so it really, even if you don't have like a title in an organization, that is totally fine. And there's a lot of ways that leadership and connections look, and still would encourage you to apply. So community partners will shape the development of the Civic Health Index based on their own experiences and insights. So, as a community partner, you can ensure that the index really does reflect the stories and truths that you hold about Rhode Island, and, really sharing how your communities participate in civic life in the state. Because also we know that, okay, I gave 5 metrics of how we can think about civic health. There are many more, right? And it looks different for different communities. So we do want that reflected. So in terms of compensation, community partners will be paid a fee of $750 upfront in full. So that, every individual community partner, $750. So in terms of who is eligible, so community partners must be at least 14 years old. They must live in Rhode Island. Because all of the work of community partners will be done in English, they must have written and verbal proficiency in English. And then also, because all of the work will be done remotely, virtually via Zoom or email, you do need to have an internet connection. So that could be, cell service on your phone doing Zoom if that works for you, or Wi-Fi on a connected device, but you do need to have an internet connection during the required Zoom meetings. So in terms of responsibilities, I think, these have been alluded to throughout, but just to put it another way. So all community partners will contribute a total of around 10 hours of their time to the project from March to June of this year. So what you need to do is attend and participate in 3 2-hour Zoom meetings. So that's a total of 6 hours. So they'll be on Wednesday, March 16th. All the meetings are from 4 to 6. So Wednesday, March 16th, Wednesday, March 30th, and Friday, May 6th. And what you will also need to do is review and offer feedback on a draft of the Civic Health Index in June 2022, as well as respond to any other emails or communications about the project. So that's about 4 hours. So that's where we get the 10 hours. And, I think I gave an overview of the agendas for the meetings, but during the meetings, community partners will work closely with, the council staff and our partners to offer perspectives on the existing civic health related data for Rhode Island, to advise on the development of a survey to collect supplemental data and to shape the story told in the index. And again, all meetings will be held via Zoom and will be in English. So in terms of how community partners will be selected, they'll be selected based on their eligibility for participation. So, that 4 bullet points that I gave to do with age, where you live, proficiency in English, and internet connection. Also, their ability to fully participate in the process as outlined, because, it's 10 hours of a commitment and we really do need those 10 hours. So those 3 meetings are going to be really important, as hopefully you see. So we do need you to be able to come to those meetings. And then we're also interested in learning about your connection to your communities in Rhode Island, as well as your interest in civic life in Rhode Island as well. So the statement of interest form, which I'll go over, includes narrative questions about those, so we can learn more about you and your connections to, what the Civic Health Index is going to be investigating. So we are seeking to work with a group of partners that represents the full diversity of Rhode Island across all metrics. So we have kind of these requirements for the proportions of our cohort in terms of the demographics. So we're seeking, and we'll have at least 3 members who are age 25 and under, at least 5 Black, Indigenous, and people of color or BIPOC identifying members, at least 5 members from outside the urban centers of Providence and Newport, and then gender parity among the groups so that the group is balanced in terms of gender. So hopefully this has made you want to state your interests. So if you would like to do that, that's very exciting. So if you would like to become a community partner, we have a statement of interest form on the council's website, and it's a Google form that's just like embedded into the website. So hopefully pretty easy to fill out. It's just 1 page. I'm going to go over in a second what's on it, but it hopefully won't take too much time. And that's due by Monday, February 28th, right before midnight. So it closes at midnight. And you'll receive notification on Friday, March 4th, so that week. And if you think, oh, maybe I don't have time to do this, but I know, my neighbor would be amazing, or whatever it may be, please nominate them. So we ask that you we all have a form for that as well on our website. We ask that you fill that out by this coming Monday, the 21st at midnight, because we will then need to reach out to them to have them complete the statement of interest form, just because we want all the same information from everybody. So they will need to then fill out the form. And again, we really do want the word to get out here to anybody and everybody who might be interested. So please also do spread the word in your communities about this opportunity. We'd be thrilled to hear from everybody. So, and then just, in case you're thinking, oh, I don't know, filling out a form seems a little intense. Hopefully it's not. Basically what it contains is questions about, basic demographic information, so your age range, where you live, how you describe your racial and ethnic identity, what your gender is, things like this, because like I said, we are going to be balancing the cohort. So we need to ask those questions in order to be able to do that. We're also going to be checking your eligibility, including confirmation that you can be present at those 3 required meetings. And then there are only 2 narrative questions. So one is, what communities do you feel connected to in Rhode Island? How long have you been connected to these communities? And how were you involved in these communities? And then the other is, why is Rhode Island civic health important to you? And why do you want to serve as a community partner for the Civic Health Index? So, and feel free to, as long as you fully answer these questions, feel free to write as much or as little as you like. And then of course we have is there anything else you'd like us to know, which is optional. So in terms of, wanting more support, if you have any more questions. So like I said, we're going to send a follow-up email with the information from this session and about the opportunity to everyone who registered, which again, please feel free to circulate that information. And again, we're also having that support session tomorrow from 1 to 3. So you can just drop in, stay for 5 minutes, dip back out. That's totally fine. And then with any other questions, you can reach out to Civic Health Index at rihumanities.org, and we'll get back to you as quickly as we can. And again, that's Civic Health Index at rihumanities.org. So please reach out to us there. And I think that concludes the presentation.